Hi everyone. In today's clip, I will talk a little bit about niacin. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, vitamin B3, which also appears under the names niacin, nicotinic acid, and niacinamide, is needed for proper circulation and healthy skin. It helps in nervous system functioning, carbohydrates, fats, and protein metabolism. It helps in bile and stomach fluid secretion and sex hormone synthesis. It also lowers cholesterol levels, and it is used in schizophrenia and mental illnesses because this is a memory enhancer as well as DNA repair tool, sort of. So niacin is water-soluble nutrient, so the body doesn't store it, and any excess is sort of flushed out with urine. In orthomolecular medicine, we have used actually combination of niacin and baking soda for years. So and it's been quite successful in reversing chronic kidney disease or CKD right up to stage 4. This is normally done through low dose immediate release niacin, 100 milligram to 500 milligram, 1 to 3 times a day, using 1/4 teaspoon of baking soda mixed to a glass of water at lunch, and 1/2 teaspoon of baking soda in water at night, and optionally adding calcium carbonate antacid pills, 400 to 1000 milligram elemental calcium, or 2 to 4 grams of antacid tablets with food to bind to phosphorus in food. Niacin deficiency can show up in symptoms like canker sores, dementia, depression, diarrhea, dizziness, fatigue, halitosis, headaches, insomnia, low blood sugar, limb pains, muscular weakness, and inflammation, just to name a few. Niacin is found in beef liver, brewer's yeast, broccoli, carrots, dandelion greens actually, dates, eggs, fish, nuts, potatoes, tomatoes, alfalfa, catnip, nettle, parsley, peppermint, etc. So it's quite available in nature. When you take niacin, usually a flush happens, where your skin turns red and a bit itchy and hot. This is normal and will not last too long. Niacin in the form of niacinamide doesn't cause flushing. The no-flush niacin, however, doesn't offer the same benefits as the flush type. And it is less successful in lowering cholesterol. To avoid severe sort of flushing, we can start by taking niacin at a low dose once a day and slowly increase the dose day by day. This allows the body to adapt to the increasing doses, which largely prevents a flush. An appropriate starting dose usually is 25 milligram taken once a day with food, and you can break the 100 milligram tablets into 4 pieces and take one every day for several days, then increase to 50 milligram doses per day taken in divided doses and sort of gradually increase over the next few weeks. Using this method, it's possible to actually achieve a dose of several hundred milligrams of niacin taken as in divided doses with meals without noticeable flushing. If an occasional niacin flush sort of happens and you feel uncomfortable, reduce the dose by a small amount. But it doesn't really matter, it doesn't do any harm. Of course, you should consult your physician to discuss appropriate forms, cautions and doses and benefits of niacin. So, one thing to note, niacin is not a liver toxin. Niacin therapy increases liver function tests, but this elevation means that the liver is active. It doesn't indicate an underlying liver pathology. Back in 2013, a widely publicized sort of interventional study on the benefit of Teradaptive, which is a compound drug that contains an extended release form of niacin, and a drug called laropiprant, was interpreted as showing that niacin may have dangerous side effects. The study was designed to determine the advantages of Teradaptive to participants who were already taking statins to reduce symptoms of high cholesterol and heart disease. So the study was focused on the benefit of a specific combination of drugs, and so could not have determined the efficacy of niacin really. This essential vitamin is already known to be very safe and effective for lowering cholesterol. Rather, the study mistakes the well-known benefits of niacin with the unknown dangers of incompletely tested drugs. Anyhow, hope this information has been helpful. Please ensure to consult your healthcare provider for any advice on any ailment you may face. Like and follow for more. Be the light.